Good afternoon, and if you're calling from the West Coast, good morning, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH Core. My pleasure to welcome you today to our webinar on the new Phase 4 CAQH Core Operating Rules Infrastructure Requirements, which, as you know, apply across transactions and establish basic data exchange requirements. This webinar will not focus on the connectivity requirements, and we're planning another connectivity-focused webinar in May. Before we begin, I'd like to mention a few logistical items. You can download a copy of today's presentation from the caqh.org website. To do so, navigate to the Core pull-down menu at the top of the caqh.org welcome screen and select the Core Education Events page. A link to the PDF version of the presentation can be found under the listing for today's webinar. On this slide, you can see a screenshot of the SMD GoToWebinar dashboard. You should see something that looks similar to this on the right side of your computer desktop. When joining today's session, it's possible you may have joined the audio portion of the webinar using your computer speakers by default. If possible, we would prefer you to join the webinar audio by telephone. To do this, please select the telephone audio button in the audio panel of your dashboard, and the dial-in information will be displayed. Make sure you enter your audio PIN, which is found under your dial-in information. We will save time at the end of today's program dedicated to responding to audience questions. You're encouraged to submit your questions at any time during this webinar by typing them into the questions panel on your dashboard. We do ask that when you submit your question, you identify the type of organization you're with so we can give you a more accurate response. Today, we have several presentations from CAQH Core staff. First, an update on the Phase 4 CAQH Core operating rules. Then we'll go in detail through the infrastructure requirements. We'll then spend some time on the benefits and value of the Phase 4 CAQH Core operating rules overall, as well as for providers and plans. Then we'll share implementation resources available to you, as well as give you an update on Phase 4 Core certification and when that test suite will be available. We'll make sure to leave plenty of time at the end to answer your questions. We'll begin today's program with an update on the Phase 4 CAQH Core operating rules by CAQH Core Associate Director Erin Weber. Erin?
Thanks, Jessica. Good afternoon, everyone. I am going to provide an update on the status of the Phase 4 operating rules before my colleague Bob shares some information about the content of the infrastructure. Just as a quick reminder, operating rules are developed to facilitate administrative interoperability by building on the recognized standard and ensuring benefit for each critical stakeholder. So operating rules are industry neutral, and they do not repeat or reiterate what may already be in the standard. There are really two types of operating rules. The first is infrastructure. Infrastructure rules establish basic expectations on how information is exchanged. For example, the ability to track response time across trading partners. Other examples of infrastructure are system availability requirements, companion guide requirements, really supporting the transmission of the transaction. The second type of operating rule are data content operating rules. And these rules are specific to the data housed within a transaction. For example, remaining deductible amount in the 271 eligibility transaction. I'll talk about this more in a minute, but the Phase 4 operating rules exclusively focus on infrastructure, and today's presentation focuses specifically on a subset of these infrastructure requirements. Before I get into that detail, on slide 6, I want to just give a brief reminder of where we are with regard to the ACA mandated operating rules and their compliance timelines. The eligibility, claim status, EFT, and ERA operating rules are already in place, and the compliance dates have passed. Entities should be conducting these transactions using the operating rules at this point. As you are well aware, the ACA also mandates that health plans must certify compliance with these 4 transactions and operating rules as another component of Section 1104. We had initially expected HHS to put out a new proposed rule next month, but we have heard HHS publicly state that this will be delayed. So Still waiting on any updates for that particular regulation. With regard to the third set of operating rules included in the ACA for claims, prior auth, enrollment, health plan premium payment, and claims attachments, the Phase 4 operating rules address all of these transactions with the exception of attachments. HHS has not yet mandated a standard for attachments. And these Phase 4 operating rules have been approved for voluntary implementation at this point in time. Slide 7 talks about where the Phase 4 operating rules are in the regulatory process. NCVHS, the National Committee on Vital and Health Statistics, held hearings last month on the Phase 4 operating rules, and CAQH Core provided testimony on the status of the rules. NCVHS then will make a decision on and a recommendation as appropriate to the Secretary of HHS on adoption of the rules. Then HHS may publish a regulation in the Federal Register once it determines what is appropriate for the federal mandate. When HHS does this, there will be a public comment period of 60 days or more whereby entities can submit comments on the regulation. Finally, based on public comments to the regulation, CMS will then publish a final rule and the industry will be required to implement the operating rules, typically a 2-year time frame from publication of a final regulation. So there are definitely opportunities still to have your voice heard. As a reminder, slide 8 talks about the process that the CAQH Core participating organizations went through to decide, first to help decide to focus on infrastructure within Phase 4 rather than trying to tackle infrastructure and data content operating rules for this set of transactions. The industry analysis really determined that for these particular transactions, claims, prior auth, enrollment, and premium payment, that infrastructure rules represent a significant step in meeting industry needs to drive well-documented cost reduction opportunities, but it's also still achievable resource-wise and technically. Data content operating rules for these transactions will be addressed in future phases of operating rules. So to get to where we were, it took approximately 2.5 years of development time. Over 100 organizations participated in public surveys seeking input on what these operating rules should focus on. Over 70 teleconferences were held by the core subgroups and work groups. The draft rules were made free and available on the website for any organization to review. Also on the core town halls, we spoke about the rule requirements as well. At every stage in the process, the required quorums and participation rates exceeded core requirements. Over 130 HIPAA and non-covered entities were involved in the rule development, representing all the key stakeholder types. And the final vote on the full Phase 4 package of operating rules garnered 90% participation and 88% approval from the core participants. And then the core board unanimously approved the package. So from the CAQH Core perspective, this set of 5 operating rules for Phase 4 is complete, and entities can begin voluntarily implementing their rules today. As for the mandate portion, we are waiting to hear from HHS on the status of that still. Now I'll turn it over to my colleague, Bob Bowman, who will talk about the scope of these operating rules. Bob?
Great, thanks, Erin. And just as Erin mentioned, we do want to provide you with the scope of the Phase 4 operating rule set. So in the next slide, on slide 11, you'll see where we basically put a graphic together to show where each of the 4 transactions within this rule set, including prior authorization, claims, enrollment, disenrollment, and premium payment, we've now established a set of infrastructure requirements for these specific transactions. And many of them are going to be the same across the transaction. So we have processing mode requirements, batch and real-time processing mode requirements, acknowledgments, safe harbor and connectivity, system availability, companion guide. You can see where each of the transactions in this rule set has specific requirements. In the rest of the slide deck in this section, we want to go through some of those specific requirements just so you have a clear understanding of what those requirements are. So if we move over to the next page, just as Aaron mentioned, when we were developing the rule set and when the different work groups and subgroups looked at the input from this industry and from the surveys that were done and from all of the analysis that was pulled together, they looked at very specific infrastructure requirements. They looked at a minimum amount of time that a system must be available. They wanted to establish requirements around that. They wanted to establish requirements around acknowledgments to ensure that transactions wouldn't get lost in a black hole someplace. They wanted to ensure that response times for the acknowledgments as well as for a real-time response would be available so that providers or your trading partners aren't waiting and guessing for where the transactions or the responses might be. They also wanted to establish a common format for companion guides for these specific transactions, similar to what we've done in phase 1, 2, and 3. They've also wanted to make sure that the concept of a safe harbor was carried through from the previous phases into phase 4 for the conduct of these 4 transactions as well. So these were the basic requirements that were laid down through the initial work that the subgroups and the work groups did, and they developed specific requirements around each one of these types of general opportunity areas. So on slide 13, on the next slide, specific requirements around the real-time processing mode. So if you conduct the transactions in real time, and again, there's no requirement to do that for any of these 4 transactions, but if you do decide to conduct these transactions in real time, the response must be made available to your trading partner, be that a clearinghouse or a health plan or a provider, excuse me. It's a 20-second round-trip maximum response time requirement. So the provider submits the claim, the health plan responds with the appropriate transaction, perhaps the 999, perhaps the 270 transaction, and the provider gets that real-time response within 20 seconds. So this specific requirement is very similar, actually the same. We have that same requirement in phase 1, 2, and 3 as well. So we carry that through for the conduct of these transactions. If we move over to the next slide, we've also established batch processing mode response time requirements. So if a batch of these transactions is conducted, let's say a provider submits a batch of 278 transactions because they have a book of business the next day, and that provider submits that transaction before 9 p.m. Eastern time on a business day, the health plan is required to respond with, by 7 a.m. on a specific set of number of business days later. And each of the transactions has a specific number of days that there must be, the responses must be made available. And those specific requirements are defined in the rules themselves. So it may vary between the 837 and 278, 834, and 820 to those transactions. But you have the idea that if a batch is submitted by 9 p.m., the responses are made available. So the provider can continue their work and ensure that they have the responses and acknowledgments available for their use. On the next slide, we've also established real-time acknowledgement requirements. Now, there's a lot of information on this slide, but we do want to make sure that you understand that the basic components. So if you submit a transaction in 837 and 278, 834, 820, basically you should be assured that in real time you'll receive a 999 if that functional group is rejected. If the transaction is rejected because of a specific error, you'll receive that error so you can understand what that error is and can resubmit the transaction, basically. There's a specific requirement for the 837 for the use of the 277CA to ensure that the provider is aware that the claim has been accepted or accepted with errors. So again, for real-time transactions, and you may or may not conduct these specific transactions in real time, but if you do, there are requirements for that. And so it really allows for a future build as the industry moves more and more towards real-time transmission of transactions. Just like we had for the processing mode, we also have batch acknowledgement requirements as well. So we go to the next slide, we detail those specific requirements for batch as well. So again, if you conduct the transactions in batch, and this is probably many of you do conduct these transactions in batch, a batch of 837s or 834s or 820s, and even a batch of 278s. If you conduct them in batch, there are specific requirements around ensuring that the 999 is available for all the transactions, and the 277CA is made available for the 837. So again, related to the timing of that and the previous requirements, you know exactly when the batch must be made available for pickup. Moving on to the next slide, we also have very specific requirements around system availability. This is, again, is one of the rule opportunity areas that the core committee wanted to ensure was made available for these transactions as well. And similar to phase 1, 2, and 3, 86% of the time the system must be up and available, ready for the conduct of the transaction. So health plans must be able to accept a batch of 837s 86% of the time. There are also specific requirements around notification of when you have system downtime. Perhaps you have non-routine downtimes or emergency downtimes or scheduled downtimes when you're putting in bugs and fixes for bugs on a weekly basis. But each of those timings, when the system is down, there's a notification requirement to your trading partner community to ensure that they are aware of when those outages when they occur, how often they occur, and perhaps when the system may be coming back up. So those specific requirements are related as well in the phase 4 rule set for each of the transactions. Moving on to the next slide, is similar to another role opportunity area that was identified was the companion guide requirements. And just like phase 1, 2, and 3, companion guide requirements are now specific for these 4 transactions in the rule set. And it specifies a flow and format for your companion guide. So it has very specific, basically a template, a master template that you can use as you publish your companion guide. The caveat here for this particular rule requirement is it only requires you to use the template if you publish a companion guide. You may be an entity that does not publish a companion guide. Perhaps your health plan has outsourced all of your connectivity to a clearinghouse and you do not publish an N837 companion guide. You're not required to now by these requirements. It's only if you do publish one are you required to use the flow and format. So moving on to the next slide, there are some very unique phase 4 infrastructure requirements, and these are specific to the transactions. Again, the core participants looked at how the transactions are conducted natively. Is there anything specific about the conduct of those transactions in an infrastructure environment that's specific to the 837? And if there were, and they were appropriate, specific requirements were developed and became part of the rule set. So just as an example, there's lots of information on this slide, but I want to share with you that for the 837, there are specific requirements around coordination of benefits. If you have specific requirements, and those should be related or required to be related in your companion guide. There are also specific requirements around processing the 999 and the 277 CA within a business day of receipt, so that perhaps you're a software vendor for a provider-side software, a practice management software system. Your system receives a 999. You have to be able to adjudicate that so the provider knows that the batch was accepted or rejected, so the provider knows to resubmit that batch of claims. So there's some specific requirements around the transaction. For the 820 and 834, there's a specific requirement for health plans to process and adjudicate the data that they receive in the 834 and the 820 within 5 business days. So again, very specific requirements around the infrastructure and the processing of the data, not the actual data, right? Only infrastructure requirements around specific transactions within this rule set. So again, all of this information is detailed specifically in the rules themselves. Last but not least, we do want to cover the last major component of the rule on the next slide, and that is the safe harbor connectivity and security requirement. And this is a requirement that all trading partners or all entities that are going to pursue phase 4 implementation, that you will support the connectivity and the security requirements. This allows for basically a network to be developed for the conduct of these transactions between all trading partners. So at a minimum, you'll support that specific connectivity, that specific security requirements. It does not mean that you have to unplug or de-implement things that you already have in place. So if you have a VPN connection between your favorite hospital and your health plan, you do not have to unplug that and discontinue that. At a minimum, you have to support the new requirements under the core rules, but you don't have to unplug anything that you already have in place. You can continue those methods. You can support other communication methods, other security methods. Those do not have to be changed or modified or unplugged. They can stay the same, but at a minimum, if a trading partner requests to conduct these transactions using the core required connectivity and security, you must be able to meet that minimum requirement. So it ensures that everyone can conduct the transactions in one unique way. With that, I'll hand the call over to Drew for our first polling question.
Great. Thank you very much, Bob. And so now we're at our first of 3 polling questions. And this is an implementation question of the Phase 4 operating rules. And it says, which stages of the implementation of the Phase 4 CEQH Core operating rules are you planning to complete in 2016? And it could be one or many, so select all that apply. And I will launch the poll, and feel free to log your response directly on your screen. And we'll pause for about 20 seconds. It'll take about 10 more seconds. And Bob and Aaron, I might just have you comment based on the results, or Matthew too. Take about 2 more seconds. Please log your response. All right, I'll go ahead and close the poll and share the results. And it seems we have about 52% explained that they're doing at least internal education and awareness. 39% of the 61% who voted said that it's analysis and planning or system design. 16% said it's systems implementation or integration and testing. 12% said deployment and maintenance. And 27% registered that they were not applicable, that they do not plan to implement in 2016. Aaron or Bob, do you have any thoughts?
This is Erin. I'll just comment that I think this is exciting data. I'm sure some of you are not implementers, so that it makes up for that 27%. But also that there are almost 250 attendees on this call, so that means quite a few organizations are going to be, at very least, begin implementing Phase 4 rules in 2016. So we look forward to providing the tools and support you need to move this process forward.
Great. All right. We will continue on. Next, we have CEQH Core Senior Manager Matthew Albright, and he will walk us through the Phase 4 CEQH Core operating rule benefits and business case. Matthew?
Thank you, Drew, and thank you all for joining us today. So you've heard the what about the Phase 4 operating rules, now the why. And you heard earlier from Aaron that the Phase 4 rules at this time are voluntary. They have yet to be mandated by the federal government. So then why implement them? First of all, let's keep our eyes on the big picture. Phase 4 operating rules are a continuation of what you all, as an industry, have built so far. Phase 4 is like the last card you need to make a straight flush. With the addition of the Phase 4 operating rules, all of the transactions will have shared consistencies, including, as we've heard, companion guide flow, system availability, acknowledgments, safe harbor connectivity, and the basic ground rules of real-time transactions. As I said, phases 1, 2, 3, and 4 operating rules bring administrative efficiencies to everyone, and most particularly the providers. Next slide, please. If you start to implement the Phase 4 operating rules this year, you'll of course have more immediate results from your winning hand. Getting started now will make you an industry pioneer in administrative simplification, and early adoption means that you can implement according to a planned budget and project plan, as opposed to waiting for the government to tell you what to do and when to do it through a regulation. And as we've seen, implementation of the Phase 4 operating rules means that you'll have consistent operating rules across all of your EDI transactions. And in terms of specific implementation impacts, we've stressed this in earlier slides, but the connectivity operating rules in this phase utilize recognized national standards that give greater assurance of information security. You may have seen in the news today that the OCR, the Office of Civil Rights, is now doing privacy audits of the business associates of HIPAA-covered entities. Just more evidence that security and privacy is an ever-growing priority for everyone. And again, the consistent use of acknowledgments and response times across all these transactions will decrease help desk call volume and make life easier for you and for your customers. Next slide, please. We mentioned before that one of the biggest benefactors of the operating rules across all phases are the physician practices in the hospitals. For those of you who have invested a lot of resources in earlier phases of operating rules, it's important to keep pounding that drum about the benefits that operating rules give providers and keep communicating that to the providers. And these Phase 4 operating rules are no different. Acknowledgements for claims and prior authorization and secure online connectivity are specific provider benefits for this phase of operating rules. Next slide, please. And of course, all those benefits to providers help health plans and their business partners as well as all stakeholders in the administration of healthcare. Actually, the Phase 4 operating rules are really a reason to celebrate. It's been just short of 5 years since the Affordable Care Act mandated operating rule sets for all transactions. And with Phase 4 operating rules, we will have that. And for those of you who have been expending resources on implementing the operating rules all along, you have a lot to be proud of. And the Phase 4 operating rules is really the crowning stroke in all the work that you've done thus far. And with that, let's go back to Drew with a poll question.
Great. Thank you very much, Matthew. And so this brings us to our second poll question, which deals with challenges to implementation. And so just like last time, I'll read the question and launch the poll for everyone to respond. And this question asks, which of the following would you consider to be the biggest challenge to your organization's implementation of the Phase 4 CAQH Core operating rules? Now, it might be more than one item listed here, but try and select the biggest challenge that you identify. And I will launch the poll, and we will pause for a brief moment for everyone to log their response. Take about 5 more seconds, and Matthew, I'll have you comment on the results once I share them. Got about 71% who voted, 72%. We'll take about 2 more seconds, and I'll share the results. All right, I will close the poll. And Matthew, the big one here, 59%. Explain that it's overcoming resource constraints, time, staff, internal expertise. 13% say fully understanding my organization's role and or my responsibility in the implementation process. 16% say fully understanding the requirements themselves. 8% say no major challenges, and 5% say not applicable. What do you make of these results?
Good, thank you, Drew. And I guess there's probably not much surprise here. I think we're all running out of time, and we're all need money. But I think this is a good tie-in to the next section, Drew, where Erin will talk about some of the resources at CAQH Core to think about your project, think about implementation, and I think what this will get to is you'll get to have a clearer idea by using some of these tools about exactly the amount of resources that it may take. In other words, after using these resources, you may find that you're closer to implementing, and you may have to use less resources than you initially expected. So we understand time, staff, expertise, these resource constraints. So just use our tools to help you get more specific about that worry, so you know exactly what types of resources and the amount of resources you may need. And I'll give it back to you, Drew.
Great. Thank you very much, Matthew. And so we'll continue on today with our final presentation, which will be co-led by Erin Weber and Matthew Albright. And they will go through Phase 4 resources and tools, as well as give an update on the status of the Phase 4 certification and testing. Erin, go ahead.
Thanks, Drew. I'll start on slide 29 with what I would call our favorite implementation tool here at CAQH Core, and this is our analysis and planning guide. And we have one of these for each set of the core rules. The planning guide can be used by your project staff to understand the applicability of the rules to your organization, identify all impacted systems, both internal and external, because you may need to coordinate with your trading partners, and conduct a detailed rule requirements gap analysis. So there are 3 different worksheets within the tool that you can download and use to conduct your analyses. And I would encourage you to take a look. There's a link directly from this slide. The next tool I want to highlight are our FAQs. We have more than 100 Phase 4 FAQs already up on the website, and we're adding more every day. We source our FAQs primarily from the questions we receive from you all on these education sessions, via email, and what we're hearing out in the industry. We also recently revamped our website, so our FAQs are now searchable and web-based, which we hope will make them even more user-friendly for you. Here's a visual of our new webpage. The search bar is right at the top there, and you can see how the FAQs are organized. We have general FAQs, and then they're organized by rule, set of rules. So within each area there are subsections, and you can click on the question and scroll down to the response. And you can link directly to an FAQ question should you want to share one with one of your colleagues. With that, I'm going to turn it over to Matthew to talk about voluntary core certification.
Thank you, Erin. We all know that entities that implement standards and operating rules, including these Phase 4 operating rules, have different ideas of what it means to be compliant with those rules. And different stakeholders, as we've seen, often adopt diverse and inconsistent approaches to testing and using the adopted standards and operating rules. So although core certification has not been mandated by the federal government, it is voluntary. We as an industry still need an ability to point to a specific standard set of documents that we can say demonstrates conformance with the operating rules and standards, and core certification with that third-party certification testing provides that. As a program, voluntary core certification, we think is really the gold standard in how a certification program should be developed and administered. This slide outlines the elements that make up a kind of checks and balances that make up the voluntary core certification program. Most importantly, among these checks and balances is that the actual requirements that are necessary for an entity to demonstrate conformance with the operating rules, including these Phase 4 operating rules, the actual test questions are developed by industry representatives through a CAQH core subgroup. Those requirements, those test questions, are then put through the same thorough review and voting process that the core operating rules went through and that Erin described earlier. That is, they are voted on by entities that are actually conducting the transactions. So this is industry deciding for industry what conformance actually means. Next slide. This slide shows the types of organizations that can get core certified and the reasons that they may want to do that. Note that basically any entity, commercial or public, that is part of conducting the eligibility, the claim status, the EFT and the ERA transactions, and soon the Phase 4 transactions can become core certified. And one thing I'd like to emphasize on the benefits of core certification, and you've heard us talk about this a number of places in this webinar, if you're a provider or a health plan, and especially if you outsource a lot of your transaction functions, certification testing is a good way to make sure that your business partners are conformant with the rules and are applying the best business practices for efficient use of the standard transactions. So ask your vendors and your clearinghouses whether they've undergone core certification testing. It's like making sure your taxi driver has a driver's license. Next slide. And all of that applies to Phase 4 certification. So make Phase 4 certification a part of your Phase 4 operating rules implementation plan. And even if you don't pursue Phase 4 implementation or Phase 4 certification, make sure that your business partners that you've outsourced do make that a part of the plan. It's a standard, centralized, by industry, for industry testing solution that will put everybody on the same field. We expect Phase 4 certification to come out, and entities can get core certified in Phase 4 in summer of this year, so just in a couple of months. Contact us if you have any questions. And with that, I think I'm back to Drew.
Wonderful. Thank you, Matthew. And this brings us to our third and final polling question of the webinar. And this is a question that Jessica and I ask as the Education and Outreach team is wondering about future webinars and what Phase 4 CAQH Core Operating Rule topics would you like to learn more about in future webinars. And this is, again, a check all that apply. There might be more than one. And I will launch the poll and take just a few seconds to log your response. This is very helpful to us because it helps us learn how we can help you better. Take about 10 more seconds. Do about 5 more seconds. Jessica, I may ask you your thoughts based on the results. All right. We've got just about 60% voted here. I'll close the poll in about 2 seconds here, and I'll share the results. All right. The big one here is 72% saying they want operating rule implementation how-to stories. So perhaps stories directly from the users themselves. We have 33% saying the core safe harbor principle, 34% saying the business drivers of the Phase 4 CAQH core operating rules, 40% saying certification, Matthew, and 19% saying the open mic or the general Q&A sessions that we have. Well, this is very helpful to Jessica and I. Does anyone else have any thoughts or input based on these results?
Well, this is Jessica, and the only thought that I have is we hear you, and we are going to use this information to craft, the Phase 4 programming between now and the end of the year. So we do want your feedback and use your feedback. Do the rest of my colleagues have any thoughts on these answers, or are we in agreement that we know what we're doing from now on webinars?
I think we have a solid plan.
Great.
Thank you to our audience.
Great. So it looks like we have time for questions. Just a reminder, please submit your questions by typing them into the questions panel on your dashboard, and please identify your type of organization so we can better respond to you. So let's begin. The first question is, do the time frames for the Phase 4 CAQH Core 450 healthcare claims infrastructure rules still apply if it's an especially large batch? Do the CAQH core operating rules define the batch size? And Bob, I'm going to send that one to you.
Great, thank you, Jessica. And it's a very fair question because the operating rules do not define a batch size. So this would be something that trading partners would determine what's the best size batch that a particular receiving system can receive, be it a clearinghouse or a health plan. So that kind of determination would be made by trading partners first. And the core rules do not provide guidance or definition of what is a small batch, a large batch, or what size batch is considered required under the rules. We just have determinations or requirements around if you conduct this transaction in batch, and batch is required for all of them, other than the 278, which you can choose batch or real-time to support. If you conduct the claim, for example, in batch, then you must have very specific acknowledgement requirements, very specific response time requirements. So you want to look at those requirements and then determine as a health plan, we want to receive batches of 1,000 claims, 5,000 claims, 10,000 claims, or even batches of 50 claims. Whatever's the best for your system to ensure that you can meet the requirements for response times and for acknowledgments. That's how you should approach it, probably. So the rules don't define the batch. That'll be between trading partners.
Thanks so much, Bob. So the next question is, why was the Master Companion Guide template created? So Bob, I'm afraid this is another one for you.
That's a very fair question, too. And this is that, for many years, trading partners defined how they would conduct the transactions by trading partner. So a health plan would have to document, usually, sometimes not, usually just through email probably, exactly how they would set up their systems and what their trading partner ID was and what their limitations were by trading partner. So if they had 3,000 trading partners, they had 3,000 different connections that they were maintaining, and everything was a one-off. Everything required some intervention manually, usually through communication with some individual to figure out exactly what the issue was, where's the acknowledgments, where's the claims, where's the black box, where's the hole at. And so the companion guide template, this idea came about really a long time ago. Initially it started with Weedy, and now with the CAQH Core Master Companion Guide template. This template allows for health plans or trading partners like a clearinghouse to identify exactly what the requirements are, to establish connectivity, testing requirements, all of the specific requirements around setting up that particular connection, what it looks like, how big it is, what the specific transaction requirements are, what values should appear in the different segments of the ISA, for example, exactly what those requirements are in one place so that it no longer has to be maintained by a one-off. So that Master Companion Guide template, we saw great success with it in phase 1, 2, and 3. The core participants continued that into phase 4 with the Companion Guide requirements for these 4 transactions as well. So it really allows health plans and trading partners to ensure that all the information that's required to set up those connections are all in one place, easy access, and it's uniform across all their trading partners.
Thanks so much, Bob. The next question, I think, is for Aaron. If a core certified entity is communicating with a non-core certified entity, does the core certified entity have to respond within the specified response time window?
So the answer to that is yes. An entity, for example, a provider, does not have to be certified by core in order to interact with a core certified entity, such as a health plan, under the core rules.
Thanks so much, Aaron. The next question is, I think it's another one for you, Bob. The question is, for batch processing mode, are there any archival or history requirements in terms of keeping responses available for some period of time?
That's a very good question. And there are very specific requirements around auditing and reporting. Now, I say they're specific in that there are requirements, but we don't go into a lot of detail. We only require that the transaction should be audited and that there should be reporting available. And there are some data elements that we identify that should be tracked, like a date timestamp, a transaction ID. We left those specific requirements pretty broad so that individual entities, as they implement the operating rules, can determine what is best for their business model. So that if you are a provider, it will look quite a bit different than if you are a clearinghouse than if you're a health plan. So leaving the requirements very broad, that there are auditing requirements, transactions should be audited, so you can ensure that for every transaction you received, every 837 you received, there is a paired acknowledgement so that every claim is acknowledged or every batch is acknowledged. So you can get down to the 1 by 1 for the batch and then 1 by 1 for the claim for the acknowledgement. So those auditing, the archiving of those audits and those reports, all of that is going to be a business decision by the implementer, but there are requirements generally that it must take place. So whatever's the best business model for you may be a little bit different for for a different trading partner type or a different stakeholder type. So again, very general requirements, they must be done. You determine what those specific requirements are. Now, for core certification, as you go through that process, and hopefully many of you do, there are going to be specific requirements about uploading a log report showing that you're tracking a specific transaction, and you have a date timestamp that the acknowledgement was received or the acknowledgement was generated and sent out. So those types of things are going to be important for you to develop, determine, implement as you go through core certification testing.
Thank you, Bob. The next question is for Aaron. Do the Phase 4 rules mandate all covered entities implement real-time transaction technology, or do the standards for real-time only apply if the covered entity makes the decision to support real-time transactions?
Thanks, Jessica. So for the phase 4 transactions, which are prior auth, claims, enrollment, and premium payment, the rules were, with the exception of prior auth, the requirement for processing mode for those are that batch is required and real-time is optional. So only if the entity decides to implement real-time do the real-time requirements apply. For prior auth entities, the processing mode requirements are batch or real-time required because some entities have moved entirely to real-time for that transaction, and so we didn't want to, the core participants didn't want to require those entities to go back to batch. So yes, the answer is only entities that have made the decision to support real-time for these transactions then are required to support the real-time requirements within the operating rules.
Thanks so much, Erin. Okay, the next question is, for product lines that are not group health plans, like gap medical, accident medical, travel medical, where claims are still submitted in the standard formats, those CAQH core operating rules, do they still apply? Who would like to take this question?
This is Bob. I'll take a stab at it. The rules do not specify the type of, I guess, coverage that's that a specific member has. The rules are general in that if you're conducting the 837 transaction, P, I, or D, professional, institutional, or dental claim, that the specific rules apply to those particular transactions. So if you are a medical health plan or a dental health plan, and you're conducting the transactions 837D, so if you're a dental health plan, then the transaction requirements, all the infrastructure requirements that we spoke of this afternoon would all be applicable to the conduct of that transaction. So it's not specific to a type of coverage that a particular member has. It's specific to the transaction that's being conducted. Now, there are, probably some caveats here for I guess some types of coverage for, and I'm trying to think of some specific examples that may or may not fall under the guise of HIPAA required requirements. But for phase 4, these are non-mandated requirements, and it's all currently voluntary core certification required. So if you're conducting any of these transactions, and you fit those types of stakeholder categories as a health plan, a provider, a clearinghouse, or a vendor, and you wish to pursue voluntary core certification, you conduct these transactions. That's where you're going to find the requirements are specific for the transaction and not a coverage type.
Thanks so much, Bob. And I think this next one's for you, so stay on the line. What kind of acknowledgement do we need to send for real-time claim transactions?
If you're conducting the claim, the 837 transaction in real time, and this is the rule is very specific that it's not related to real-time claims adjudication. So again, there's a big divide here between supporting real-time claims adjudication, which the core rule does not address, versus conducting the 837 in real time. And maybe a good example of this would be a provider has a batch of claims, they submit it to a clearinghouse. The clearinghouse parses that batch of claims and then submits the claims in real time to a health plan. So that is probably a good example of where this rule applies. That clearinghouse should expect to receive 999 for each one of those real-time claims that are coming in. Again, these are not real-time claim adjudication, not for RTA, not for real-time claims adjudication, but the clearinghouse is submitting the transaction at 837 to the health plan in real-time mode. So the health plan should be able to acknowledge each of those real-time 837s with a 999 that it was received or rejected, whatever the case may be for the conduct of that 837-999. And then also be able to acknowledge with a 277-CA. So there's specific requirements for conducting the 837 in real time and in batch.
Thank you, Bob. The next question, I think I'm going to ask Erin and Matthew to respond. And the question is from a health plan. The question is, as the CAQH core operating rules are based on the ACA section 1104, do they only apply to fully insured commercial products, or do they also apply to Medicare, Medicaid, and self-insured ASO businesses?
So I'll take a first stab at this, and then I'm going to turn it to Matthew to give some of the detail. The first point I want to make is a reminder that the Phase 4 operating rules, which we've discussed today, have not yet been mandated through the ACA. So in terms of applicability, any health plan vendor, clearinghouse, or provider is welcome to implement the rules on a voluntary basis. We're still waiting to hear from HHS on whether or not the rules are mandated. For the previous phases, phases 1 through 3 operating rules, and if phase 4 becomes mandated, Matthew, do you want to talk about the types of entities that would apply to in terms of, it looks like they're really looking at health plans. Is it just fully insured commercial products, or do they also apply to Medicare, Medicaid, and self-insured?
Good question. The Affordable Care Act uses the same terminology as the original HIPAA. In fact, it's amending the original HIPAA. And so for the operating rules, the same rules apply that once and still do apply to the standards for those transactions, the X12 standards for those transactions. And that is that all HIPAA-covered health plans are expected to be compliant with these standards and operating rules. HIPAA-covered health plans includes group health plans, self-insured plans, fully insured plans, insurance issuers or carriers, as they're sometimes called, and Medicare, state Medicaids, other government health payers. So it's a large category, and technically the standards and the operating rules, and as Erin said, the operating rules that have been adopted by the federal government so far apply to all of those HIPAA-covered health plans. Now, how that plays out in practice is probably a different question. So certainly if you're a self-insured group health plan, you probably don't even know what a electronic remittance advice transaction is. So when it comes to enforcement and it comes to who would be responsible, that's almost a secondary question. But in terms of who it applies to writ large, theoretically, it's HIPAA-covered health plans. And another way of thinking about this is it's the same category of health plans that are required to comply with the privacy and security elements of HIPAA. So that probably doesn't answer your question because you really want to know what you're responsible for. But from the point of view of law, that health plan category includes all HIPAA-covered health plans.
Thank you, Erin and Matthew. I think the next question is for Bob. The question is the TA1 response required for all business transactions?
Another very good question, because we've mentioned throughout the afternoon about the 999 and the 277CA transaction for claims. The core operating rules do not have requirements specific to the TA1. So that would be a business decision between trading partners, how and how they wish to conduct or use the TA1, either through initial testing with your trading partners or continuing that through your production environment. The core operating rules do not address the TA1. But let me add that it doesn't prohibit the use of the TA1 either. So it's silent. The core rules are silent on the use of the TA1.
Thank you so much, Bob. The next question is for Matthew, and the question is, if my organization system is not changed to return the 999 acknowledgement, can my organization still become core certified?
So no. So if you want to become core certified, core certification is based on, it's basically a series of testing tasks that are based on the operating rules themselves. So whatever the operating rules require, there is a testing task, or in most cases there's a testing task that you need to meet in order to demonstrate conformance in order to get core certified.
Thank you, Matthew. I've got a question here that I think is another one for you, Bob. And the question is, in the real time for claims, should that be one claim, and what is the expected response? Should it be a 999, a 277 CA, or something else?
Another good question, very specifically around the conduct of the 837. So if you are conducting the 837 in real-time mode, and you transmit that to a clearinghouse or to a health plan, the expectation is that in real-time mode, and actually, just we might want to pull this slide up. I'm just trying to grab it myself. Slide 15. A health plan must return the 999 to indicate that the functional group is rejected for if you're conducting the transaction 837 in real time. You must also return the 277 CA to indicate that the functional group has been accepted or accepted with errors. So you're going to get one response back, either a 999 because it was rejected, or the 277 CA that it was accepted or accepted with errors.
Thanks so much, Bob. The next question is, my organization includes system availability schedules in our companion guide. Does this satisfy the CAQH core operating rule requirements for system availability reporting? I think it's another one for you, Bob. Yep,
I'll take this one. Yes, the core rule requirements say that you must publish when you have regular scheduled downtime or holiday scheduled downtime. So publishing that information in your companion guide would meet and satisfy the requirements for the core rules. So that works.
Thank you very much. Let's see. Okay, here's another question, and I'm not sure if this is a question for Aaron or for Bob, so I'm going to send it to both of you. Will CAQH be developing operating rules for the 278, 215 in the future? I guess this is maybe talking about what our future plans are for operating rules. So the question, yeah, go ahead, Bob.
I was just going to jump in and say that it's a very fair question that we generally write operating rules specifically around the HIPAA-adopted transactions, but not always the case, as we have operating rules around the 999 and the 277 CA. Any sort of future operating rule requirements related to the 278, that specific flavor of the 278 that's used for a very specific business function, would definitely be some feedback that we can take in for future rule development. We're always looking for opportunities to build operating rules around transactions or standards that can have a very immediate business impact and reduce administrative burden. So if this is a transaction that would be very helpful for the industry, if its operating rules can help the conduct of the transaction, that's definitely feedback that we would like to have, and we can definitely consider that for future rule development.
Thanks so much, Bob.
Great.
Thank you so much. And it looks like we're about out of time for today. I'd like to leave you with some takeaways on this next slide, and would also like to thank all of our speakers and thank you as well for taking time out of your busy schedules to join us. I hope you found the information in today's session useful, and if you have questions or are interested in learning more about the topics that we cover or the work that we do, or if you have ideas for future webinars, please go to our website at caqh.org/core, or send us an email at core@caqh.org. And don't forget to complete our post-webinar survey. A recording of the session will be available on our core website within the next 24 hours. And finally, we have some webinars coming up, one on the Health Index on March 30th, and we also have some future Phase 4 programming coming up in the next few months, so please keep checking back on our website. Thank you and have a good afternoon.